Nutrition Deficiency Disorder in Ayurveda is today's topic. Nutrition Deficiency Disorder or NDD is not under any specific chapter in Ayurveda, but we will get a deep core understanding of this topic under various references. Today in this video, we have analyzed all the possibilities where NDD can be correlated. They are Karshya, then Balaroga, Rajayakshma, Pandu, Virudhahara, Dhatvagni Mandya, Kshaya. First topic is Karshya, or in simple terms Emaciation. It is considered as Ashta Nindita Purusha. The word meaning of Ashta is 8. Nindita means undesirable persons. It is because of Rasa Pradoshaja Vikara, Veposhida Rasadadu. That means because of the vitiation of Rasadadu. Rasa can be considered as lymph or plasma. And the references have taken from Bhav Prakasha textbook. This is the picture from American Civil War. Here the symptoms of Karshya can be clearly seen. First symptom is Shushka Svikudara Griva. That means emaciated buttocks, abdomen and neck region. Dhamani Jala Sannibaha, prominent veins. Tokka Dishtida, skin-bone appearance. And Stula Parva, prominent joints. Also, Karshya can be taken generally as kwashiorkors and marasmus, which are protein energy malnutrition, but it can be also taken as a proper correlation under Balarogas. Or in generally, Karshya is taken as undernutrition. But in some cases where the etiological factors are unknown or any eating disorders where the psychological factors come into play, such as anorexia nervosa and bulimia nervosa, Karshya can be taken. Now comes Balaroga. Under NDD, we discuss and analyze three main Balarogas. They are Balashosha, Parigarbhiga and Phakaroga. The reference is taken from Ashtanga Sangraha and Kashyapa Samhita. First we will see marasmus. It can be discussed as Balashosha. The symptoms include arochaga, anorexia, jwara, fever, shosha, emaciation, snigdha mugha netra, unctuousness in face and netra. Kwashiorkor can be considered as Parigarbhiga. The symptoms are abdomen distension, anaha, respiratory illness or discomfort, chest discomfort, urashula, lethargy, moha, loss of appetite, aruji. Rickets can be taken as Phakaroga, and Phaka means the weakness or instability, especially in legs. Roga is disease. The symptoms are bowed legs. Ayurveda says it as Vakrapada or Chalana Asamartha. Then another symptom is stunted growth, Vikritavada, bone pain, Shula, and large forehead, trouble sleeping, Anidra. Then Rajayakshma. Rajayakshma is considered as Ashtamahagada. Ashta means 8, Mahagada is deadliest diseases. It is also considered as king of diseases, that is because it is a chronic washing disease. Among the 4 types of Rajayakshma, here we have taken Kshaya Rajayakshma as NDD. This is the reference from Charaka Chikitsa, where the first 2 lines are etiological factors or causes, then coming to the symptoms. Here, the speciality is the references also taken psychological factors and Pradiloma Dhatukshaya as causes, such as Irsha is jealousy, Bhaya, fear, Trasa, anxiety, Krodha, anger, Shoka, grief. Ativyavaya is excess sexual indulgence. Because of this, there will be Ojakshaya, depletion in nourishment, and which will lead to various symptoms. Symptoms can be 3 rupee, 3 times, 6 types or 11 types. That you can see in the coming lines. They include anorexia, aruchi, diarrhea, atisara, Sleshmala Chardi is vomiting, Raktastivana or hemoptysis, fatigue, shrama, cough, kasa, fever, jwara. Panduroga or anemia. The symptoms are Panduta, pale skin, Daurbalya, fatigue or weakness, Shwasa, breathlessness, dyspnea on exertion, hridrava, palpitation, increased heart rate, aruchi, loss of appetite, swedadikya, excess sweating can be correlated to autonomic symptoms also. Virudhahara, Sankirna Bhojanam Virudhahara. This is the reference. That means which food or diet should be taken and which should not be. Virudhahara not just means a bad food combo, but it refers to biochemical incompatibility, which will result in functional neural deficiency, impaired metabolism, and systemic effects. Now we will see hand in hand what Ayurveda, Virudhahara, and modern have to say about this. In Ayurveda, inherently incompatible food combination is taken, where also modern diet that hinder nutrition absorption or metabolism is considered. Example in Ayurveda, milk with fish, dugdha matsyadi viruddhaharir vihitaha. Modern considered high phytate diet reduce iron and zinc absorption. In Ayurveda, Virudhahara will result in ama, dosha imbalance and dhatu dysfunction. Modern says gut inflammation, enzyme inhibition can be resulted from this. Dhatvagni Mandya, that means impaired metabolic fire. Let's analyze the steps involved in this. First, Ahara Rasa, it will reach into abdomen or stomach, where the Samanavata ignites the Jadavagni, that means digestive fire. Then comes Panchabhudagni into action, and the Ahara Rasa enters the general circulation through Vyanavata. Through Kalekapotanyaya, nutrient substances accepted by concerned dhatus. These many steps are in gross level or macro level. Now the microcirculation level or Dhatvagni comes into action, where the Dhatvagni convert these nutrient substances into Poshya Dhatus or Dhatu proper. If this Dhatvagni step is not occurring properly, it will lead to nutrition deficiency disorder. The last correlation is Dhatu Kshaya, depletion of one or more tissues of the body. First, Rasa Kshaya. Rasa can be taken as plasma or lymph depletion. This reference is from Ashtanga Sutra, where the functions of all tissues or dhatus have been mentioned. Rasa Kshaya will lead to Shrama, fatigue, Shosha, emaciation, Glani, exhaustion without any work, Shabda Sashnuda, noise intolerance, and these symptoms are more seen in modern vitamin B1 or thiamine deficiency. Appetite loss and fatigue are two symptoms of this. Now, Rakta Kshaya, iron deficiency, anemia, and folate vitamin B12 deficiency can be correlated to this. Mamsa Kshaya, the symptoms Angaglani, Gandasvik Shushkada, Sandhi Vedana. In modern nutrient deficiency, it can be correlated under vitamin D deficiency, zinc deficiency, protein energy malnutrition, and joint instability. Next, Medakshaya, fat soluble vitamin deficiency, that is vitamin A, D, E, K, can be caused because of this. The symptoms dry skin and poor wound healing. Asthikshaya, deficiency of calcium, vitamin D, magnesium, phosphorus, Asthitoda. Majjakshaya, bone marrow or nervous tissue can be taken as majja. The kshaya can result in deficiency of vitamin B12, omega 3, fatty acid, and iron. Now, Shukra Kshaya, zinc, selenium, vitamin E deficiency, which result into infertility, low libido, and poor vitality. We have covered one more video of nutrition deficiency disorder treatment aspect in Ayurveda. Please check it out.